Testing 1, 2, 3, testing 1, 2, 3. Good afternoon. My name is Effie Habsha. I'm a prosthodontist working in Toronto, Ontario. And today what we're going to do is I'd like to present a small case presentation which relates to a fistula that was found buckled to a recently placed implant-supported crown. So this is a presenting patient. She was referred to our practice, a 23-year-old female. She had a non-contributory medical history and was congenitally missing her maxillary lateral incisors, so the 1, 2, and the 2, 2. She had a couple of implants placed. The surgery was completely uneventful, and her general dentist provided her with 2 implant-supported crowns on the 1, 2, and 2, 2 sites. Both these crowns were cemented on custom ceramic abutments. Now, patient didn't report any pain. Her healing was uneventful. She was pleased with the aesthetic outcome. She was very happy with the treatment. But what she noticed was several weeks, almost a month following implant placement, the crown placement, I should say, she noted what she called a bump along her gum line. So, intraoral and radiographic findings, she was referred to our office, as I said, by her general practitioner, and we noted 2 cemented crowns on the 1, 2, and 2, 2 implants. And what you can see in this slide here was a fistula that was present, just buckled to the 2, 2 implant. So it's very obvious on the screen here. You can assess it. Again, it wasn't painful, but it was obviously, as she called it, a bump. It's interesting to note that the implant crowns were not mobile. She was completely asymptomatic. However, clinical evaluation revealed that the soft tissues around the 2, 2 implant-supported crown were sensitive to probing. And radiographically, you can see it's a straight-walled external hex implant. And you can appreciate from the radiograph as well that there is a custom ceramic abutment. This is a particular abutment that was used that was customized with a ceramic crown that was bonded onto the implant, onto the custom abutment. So that's how this patient presented to our prosthodontic practice. And what I want to leave you with are a few questions. The first one being the most obvious one: what's your differential diagnosis? The second question being, how would you manage this case? What approach or what protocol would you take to address the patient's concern, to address this fistula that presents? And finally, what considerations are the most important in avoiding this sort of situation from arising? So how can you avoid this bump from developing around the implant crown? So I hope that gives you something to think about, and I look forward to receiving your questions and comments and your answers to these to the posed questions. And we'll follow up in case 2 or in a follow-up to this presentation for exactly how we manage the case and what factors that I recommend to avoid this sort of situation from arising again. Thank you.